The following segment is brought to you by Intermountain Healthcare and the Utah Department of Health.
Welcome back to 2 News at Noon. We are talking suicide. You have to talk suicide with Jason Conover. He's a licensed clinical social worker in Utah Valley. Jason, thanks so much. I guess what's the first way to approach someone who might be thinking about suicide?
Well, I think the thing to remember right off is that openness is going to be very helpful in these cases. We've got to break into the secret, into the silent with gentleness and kindness, but be really concerned because this is a serious problem. And we can be lifesavers in these kind of situations. A few key points. Don't be afraid to ask if the person is depressed or thinking about suicide. These are okay questions. People won't be offended. They're generally happy to have someone be concerned. Ask if the person is seeing a therapist or taking medication so we know if they have a team or support on board. Rather than trying to talk the person out of suicide, this is a very important point. Let them know that depression is temporary and treatable. So there's hope. We don't try to power struggle with them or use guilt or shame or those kind of things. Just support them and listen to them.
And in some hotline number, I mean, there is help available. If you want, help to call somebody
Yes.
or say, hey, let's call this number.
Absolutely. And you can call that number as a helping person or as a person yourself that's struggling. And I want to reach out and extend hope to people that are feeling suicidal as well as those trying to help, because this is something that can be benefit, that can help in our world and our culture. So in some cases, the person just needs to know that someone cares and is looking for the chance to talk about his or her feelings, and then we can encourage them to seek professional help.
Well, it is a big problem here in Utah. 2 Utahns a day die by suicide, and if people could step in and help, we could have some solutions here. Jason, thanks so much. Great advice. And if we do have the hotline numbers, you can also go to KUTV.com and click on Check Your Health for more